saying this is an entertainment channel only. So that's going to be the basis of everything we talk about today. If anyone disagrees, it's totally okay. This is not a democracy. This is a piece of art. This is entertainment. So today we're talking about pelvic tilt, which I'm not really sure why it's such a controversial topic, but I'm going to talk about how it helped me to understand this and start to work on this. So first, let's just talk about what pelvic tilt is. It's the concept of your hips starting to point forwards. Forward pelvic tilt is the most common. There's also posterior pelvic tilt, but this anterior where the top of the hips start to point forward, and that can cause excess strain on the low back. That is the theory. What it is caused by and does it matter? We're going to talk about that. So first, let's talk about does it matter? I'm going to say it's up to you because this is a piece of art. This is entertainment. But honestly, my experience was when I hurt my back, I scoured the internet looking for PT protocols and all the information on how to fix your back. And truthfully, I went through all the normal protocols and I found some relief, but I didn't get fixed fully. And so whenever I followed the grand experts and there were certain topics that were just deemed irrelevant, a non-factor, I took that as scripture, I took that word, and so I didn't work on it. I didn't explore it. And it wasn't until later on that I did other training and was forced to look at these things that now I was able to find improvement on things that I thought didn't matter. And this only came about through me giving up the expertise. And so my advice to you is to really be your own expert. Explore everything. If you find any trails of clues, of anything that may affect how you feel, I would absolutely explore that, and I would keep curious. And because there's a lot of people out here that have done everything they're told, have been through the ringer of treatment, and been through surgeries, been through many rounds of PT, and they're not better. And I'm not dissing the professionals. No one's gonna know more about your back pain than you, truthfully. You live with your body every day. So that's all I'll say on the discernment. I found that it did matter for me a lot, and I'll talk about how to train for it. But first, also, just say, why do people discredit it? Why is it a controversial debate? It's because in exercise science and a lot of science, we try to find what is the cause, and we mainly talk in these absolutes. And if we can say that something causes it, then we know the firm solution. The problem is causation versus correlation. It's a silly debate because everything was correlation until it was proved to be a cause. Everything was a theory until it repeated enough times that we now say it's a fact. All facts was once a theory. So even in correlation, you can find a trail of something that really is relevant. And what I mean by that is, what if I said, this is going to be a hot thing to say. What if I said that coffee after 6 p.m. causes cancer and heart disease? You'd be like, all right, buddy, where'd you go to school? You're like, I dropped out, clearly, it's entertainment. But, so you couldn't make that causation, but here's where correlation comes in. Having drank coffee after 6 p.m. could lead to, definitely does, a decrease in sleep quality from your deep rest stage to the REM and all the restorative stuff that sleep experts could tell you about. If you have coffee late at night, your sleep is going to tank. So what if you did that every day? You're going to have chronically terrible sleep. Now, what is also correlated with chronically terrible sleep? Heart disease, cancer. You can't say that coffee causes cancer and heart disease just in the real world practice. If somebody